President Obama says despite all the problems with the website, the underlying design of Obamacare, he says, is basically fine. This is a tricky statement because the economic machinery of this legislation only works if you get enough people and the right kind of people enrolled. Let's start with the first part. The administration has said this will be a success if 7 million people sign up by the end of March, the open enrollment deadline. All the calculations going forward are based on that many people who are currently uninsured choosing to pay premiums and get covered rather than be fined, even if the fine is lower than what it's going to cost them for the coverage. Second part, and this is the more important part, especially according to analysts like the folks at Brookings Institution, about 40% of these people have to be young and healthy because they are the cash cows in this system. The savings from all of the health services that they won't use will help pay for the older folks and those who are chronically ill. If you end up with a lot of sick people signing up and a lot of healthy people staying away, it doesn't matter what your total will be. That's called adverse selection, and that could put the program into deep economic trouble fast. Wolf?
You know, even though the administration is releasing very few numbers, if we take a look at what has been released so far, are we getting any indication, Tom, that they're moving along on track, or we just don't have enough numbers to make that conclusion?
Well, we don't have enough numbers, that's obvious, and it's a little hard for them to say the numbers show it's working if they keep saying we don't have the numbers. How would they know? But in any event, let's be very generous about this and say the White House says close to 500,000 people have filled out applications for Obamacare in the first 20 days. So if you work that down, you come to about 25,000 people per day in this process. And let's say that all of these go forward and all of them complete the sign up and all of them make the payment and all of them join the program. Then if you do the math for the number of days between the end of March, what you come out with is about 161 days around there. And that means about 4 million people signing up. That's well south of the 7 million they say they need. Now, I will say in Massachusetts, when they did their health care program, at the beginning, what you saw was a slow ramp up and you saw a big rush at the end. So they could have a push at the end. But at this moment, based on these numbers, that 7 million mark seems very far away. Wolf?
And Tom, when they say almost 500,000 people have signed up, that's just the initial step. Yeah. They haven't actually bought necessarily policies or anything, but they're online, they're signed up to the Obamacare website, but that doesn't mean that there's 500,000 people who've already bought health insurance.
That is exactly right, Wolf. And the problem here, the president keeps highlighting these people who have serious medical conditions and how this helps them. It does help them, there's no question. You don't have insurance, it helps you. But the people that this system needs is not those people, as much as it may help them. What it needs is those healthy people who will decide it's worth completing the process, even though economically it may not seem that way up front.